Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
In endometrial carcinoma, the staging procedure. The staging procedure in endometrial carcinoma is by surgical staging. In surgical staging, we will stage and treat the disease at the same time. The steps of staging are as follows. Do an MRI. First and foremost, do an MRI. Transabdominal hysterectomy and bilateral salpingo-oophorectomy is done except in cases where cancer has involved the cervix or structures below the cervix. Like Werthin's hysterectomy is done in such cases, and in cancer of stage 3 and stage 4, we can do debulking surgery. Lymph node dissection is also done, and infracolic omentectomy is done in case of serous variety. Infracolic omentectomy is done in serous variety.
thank you and thank you for watching.